Hello, my name is Valerie Flatus. I am the Associate Dean for Equity, Diversity, and Inclusion at the College of Nursing. I am coming to you today to talk about the disproportionate impact of a pandemic on women in underserved communities. COVID-19 threw us all for a loop to about 2.5 years ago. And I didn't plan to spend 2.5 years working from home during the pandemic. And I remember thinking about people who were working in jobs where they made a minimum wage or lower and who were living paycheck to paycheck. And I remember feeling confused about the information we were given by various government entities. And I felt like if I was confused, I wondered what people were thinking and feeling who had less medical knowledge. And in looking at data that was collected during that time, both qualitatively and quantitatively, showed me that there was a lot of confusion as well as a lot of misinformation that was out there related to the pandemic. So the question that came to mind for me was, how closely do we want to examine the data? And then how do we make the necessary changes regarding health disparities, social determinants of health, and health equity? And as you can see, the impact on Blacks and Hispanics more than non-Hispanic whites was 2.8 times higher. And then for American Indians and Alaskan Natives, it was 2.6 times higher. COVID-19 affected everyone across every sector of the economy. And the folks who were most affected were people who were from underserved communities. And it depended on where you lived, what your zip code was. There has been some research in recent years regarding zip code having an impact on the health of a neighborhood, and also zip code having an impact on access to care. So it depended on where you lived. And an example that I think of is thinking about purchasing a new house, especially if it's in a different neighborhood. Like if you have school age children, you're going to consider the schools, but you're also going to look at what resources are available in the neighborhood. Also, what services the community has available. A good number of people don't have that option. And many live in areas where there are less resources available. And part of that is based on socioeconomic status. Part of that is based on what type of job they have and what resources are available to them financially. And then I also think about rural areas and access to resources and services in those areas. And for some people, access to those services could be miles away. I also thought about racism as a public health issue, and that racism is a threat to overall health. And what came out during the pandemic was the overarching effect of health disparities with folks from underserved communities, and especially people of color. It's stressful. Racism is very stressful. We know that one's immune response can be lowered because of stress. And then that toxic stress can cause a lifetime of psychological scars. thinking about women as well as underserved communities in terms of the effect and the impact of the pandemic. And I already mentioned the impact on social determinants of health. I mentioned the impact of racism. And we've had huge losses of workers from the workforce, especially women. And the healthcare system is continuing to lose workers, and quality of care will be affected because of that and has been affected. And the service sector employment has been affected, like restaurants and entertainment, the entertainment industry. Some restaurants were closed for a long time. Some owners of some restaurants had to think of other ways to secure an income for themselves and their employees. And the government stepped in and offered some payments to some people. And we know what the impact of that was. Financial insecurity increased. And we also know that access to healthcare was decreased depending on if the clinic was open, or if they were doing telehealth, or if folks had insurance coverage and they could go to that particular clinic or hospital, or if they lacked health insurance. And other services were impacted. And the pandemic isn't over. In my opinion, it's not over. Kate Power wrote an article around the COVID-19 pandemic has increased the care burden of women and families. And in the article, she talked about the care economy. And it's the work that's not recognized that encompasses raising children, cooking, cleaning, the things that happen every day. And the care economy is the invisible and unpaid work of women. Globally, women and girls are responsible for 75% of unpaid care and domestic work in homes and communities every day. There were other factors that were related to the pandemic. I have some listed here, but I'm sure you could think of others as well. And I had already mentioned the widespread economic insecurity, also the threat to psychological safety, that we had more mental health issues. There were more people who were overdosing on opiates. There were people who were dying because they were afraid to go for health care. And they had conditions that caused morbidity and mortality. And there was an impact on overall well-being for everyone. We tend to be very social people, and it impacted our well-being. And that's why I think a lot of people couldn't wait to get out of their homes to get back out to being social again. And then, of course, I had already mentioned the impact on children and childcare. Some school districts had to develop creative ways for children to be able to access the internet. And then, because some kids didn't have internet access at home. And then I also found an NPR posting, or an NPR article related to the Utah Women in Leadership Project. Susan Madsen is the director, and she discussed findings from a survey of women in Utah on NPR. And the survey substantiates the things I mentioned previously, that it was quite a challenge, and that stress increased due to lack of flexibility with work. Women of color were affected more, and they struggled and had bigger challenges in the state of Utah. More research is needed to examine the impact of the pandemic. And community health workers were the folks that I just had to say they deserve some credit for going out to the communities that they lived in, and they're a bridge between the community and the healthcare providers and access. And they were encouraging people and educating people about testing, vaccines, and boosters. And they are the folks who can be our partner in achieving optimal health in underserved communities. They look like the people we would like to serve. We need better data collection in the underserved community, and we need to disaggregate the data so that we can see who really is being affected by pandemics or anything else that occurs in various communities related to the social determinants of health. Thank you, and I will take questions.